So in this video, I just wanted to answer a question around what's the difference between ME chronic fatigue and depression. Now, the first thing I think I should say is that depression is its own very real, legitimate experience that somebody can be having. Nonetheless, if somebody has ME chronic fatigue, having that labelled as depression is firstly unhelpful in terms of the understanding of that person of what's going on, but it's also really important in terms of getting effective treatment, because treatments that are effective for depression are not necessarily the appropriate treatments for ME chronic fatigue, and vice versa. So we have a really clear way of discriminating the lived experience of these two things. If somebody is depressed, generally speaking, all they want to do is to get into bed and hide away from the world. If somebody has ME chronic fatigue, generally speaking, all they want to do is get out of bed and come into the world. So there's a very real difference in terms of the actual experience, the lived experience, in terms of what's going on. There's also a very big difference in terms of what's appropriate in terms of treatment. If somebody is depressed, often challenging themselves to do certain amounts of physical activity can actually be really helpful. It gets the body moving, it tends to move our emotional state, and it can actually, it's been shown that exercise can actually improve levels of depression. If somebody has ME chronic fatigue, and especially if they're on what we would classify as stage 1, the crash stage, physical exercise is about the worst possible thing that you could do. So making the distinction is really important. I think people with ME chronic fatigue often feel depressed at certain points in their recovery, not because actually they are depressed, but because they're human and they're unable to do all the things they want to be able to do in their life, and they have a human response of at times feeling sad and feeling frustrated about that. So hopefully that's helpful in clarifying the difference, and as I say, the difference is important both in terms of having the right understanding, but also in terms of what's appropriate in terms of effective treatment.